SMX medical update time. We bring back Dr. Joe McGinley of the McGinley Clinic, but this is cool. We're actually taking fan questions. We asked you folks on social media some questions for the doctor to get answered. I think this might be a Hayden Deegan fan, really living vicariously through his favorite rider. The question is, should I get plates and screws removed from my wrist? Dr. McGinley, what do you think?
First of all, we had a bunch of great questions. We narrowed it down to some of the most relevant, and it was just fun to see what the fans were interested in. This obviously is timely with Deegan's surgery this past off season. So as far as hardware, if you've had an injury and you've had hardware placed, you don't necessarily need to get it out. So a lot of people think because there's metal in there that it has to come out. That's not true. These are inert materials. They can stay in your whole life. However, the main thing on getting it out is it bothering you or not? So if you're having symptoms from the hardware, that usually means that there's rubbing with the soft tissues, either the tendons or the muscles. That's definitely time to have that considered as far as removal. Some of the things that can happen, the surgical screws can be too long. So these are screws just like you would see at your hardware store, a different material, but they sort of look the same. So when you put some of these screws in, sometimes the tips will stick out on the far end. And if you have a pointed screw tip and you're moving, if you can imagine if you had a wrist screw and one of those screws are too long and you're moving your wrist, that's going to rub and irritate all the tissue. So in that situation, it needs to come out. Otherwise, it's going to cause further damage. I think in Hayden's one of his posts, he mentioned he had a torn ligament inside the wrist, possibly from that screw. So that would make sense to get that out. But other times, it could be just the hardware itself. So it doesn't necessarily have to be a long screw. It could be the surface of the screw, the head of the screw. It could be the plate. And just the normal rubbing of the tissue over that material can get irritated over time. So if it's bugging you, it's usually best to see your doc, see if it needs to come out, see if you can get that taken care of. One of the products we worked on over the years was to prevent this. Our IntelliSense drill senses as it's drilling, so it'll automatically stop before that screw placement can be too long in the bone. So we thought of this problem earlier and said, is there a way to prevent it? And the answer to that question is yes. But if it's bugging you, get it out. Otherwise, just leave it alone, because there's no such thing as a perfect surgery, and things can go wrong even in the most routine of surgeries.
So Dr. Joe, injuries are prevalent in our sport. You know that all too well. I think for most riders, they're willing to accept that, but if they can minimize them as much as possible, that's the goal. So from your perspective, what would you say are some of the best ways to help avoid injury throughout the season?
Well, we're in the off season now, so this is the time you prepare for the upcoming season. So first and foremost, if you've had any nagging injuries that have been sort of dragging on through the season, get them taken care of. You have the downtime, you have time to rest, get it taken care of now. Second thing, a lot of riders don't think about is planning for the upcoming year, setting your goals, listing the races that you are undoubtedly want to go to and compete at, and then sort of work backwards from there. So once you have that schedule, say, what are my priorities and how do I get to those goals? If your goal is to get to Anaheim 1, you got to be on it, right? You need to be training now and getting ready to go. Whereas if you say, hey, I'm looking for this race in June, you have a little bit more time to prepare. So you want to take that time to prepare and then come up with a program that's going to work best for you. There's all levels of riders, whether you're just recreational rider, novice rider, or a top pro. You're going to have different plans and programs. One of the biggest things, though, is getting a health team together for you that works for you and works best in your program. So having a riding coach, having a trainer, having a nutrition coach, and then the one thing a lot of riders will forget about are sports psychologists. I've seen it a lot with riders, especially at the end of the year. Not only are they physically fatigued, but they're mentally fatigued. A lot of these kids, they're traveling every week. They're not sleeping at home. They're sleeping in hotels. They're sleeping in RVs. That wears on you over the riding season. So this time of year, you want to rest. You want to make sure you heal up, but then plan that program for next year. And don't forget the mental aspect of it. If you're mentally prepared, you're more likely to be physically prepared coming up into the season and getting things taken care of. So now's the time to do it. Plan for success and then enjoy the race season. Take care of everything now.
All right, Dr. Joe, thanks for the update. We'll catch up with you again as the off season rolls on.